we have. Obviously, the big achievement of the pandemic was the breakthrough technology in creating the mRNA vaccines, and then, of course, in record speed. And there are some experts that think that this could be applied to cancer care. So can
Yeah,
you just walk us through that a little bit and help us understand how it might apply and why some experts think there could be big advancements in cancer
yeah,
care because of these vaccines?
yeah. I want to correct one thing. There's this perception that this vaccine was created very quickly. This vaccine was created due to technologies that actually came through cancer research over the last 50 years. It actually starts with Richard Nixon signing the National Cancer Act in 1971. And we've had messenger RNA vaccines for over 20 years involved in cancer research. And then very quickly last year, they took all of that technology and turned it into coronavirus and developed the coronavirus vaccine. So the research has been going on for, in some instances, 40 to 50 years in certain areas. But we do hope that we're going to be able to take messenger RNA and actually program it to an individual patient's specific cancer. This is real true precision medicine where each vaccine may very well be tailored to that particular patient's molecular biology. And we may be able to treat some cancers with mRNA vaccines through this process. That's the hope. And now we started doing this research about 20 years ago with messenger RNA vaccine technology, and it's getting better and better. And it actually is starting to be tested in some patients with cancer, ironically, at the same time that messenger RNA vaccine is saving so many lives with coronavirus.
Well, I take your point that it was not overnight and that this research has been going on for a long time. So, to that point, I want to know, do you think that cancer vaccines could be possible in our lifetime?
I think cancer vaccines are going to be widely available in our lifetime, and they are going to be effective. I cannot promise you that they're going to be as effective as the mRNA vaccine for coronavirus, but I do believe they will be available, and I do believe that they will be effective in the treatment of several of the major cancers out there. I think there's tremendous reason for optimism, and this whole story tells us that we really do need to support scientific research and scientific progress. This is an appeal to continue supporting the National Institutes of Health, who's given us so many of these things.